Anxiety is one of the most common illnesses in the United States, and my goal in this video is to inform my audience on the meaning of anxiety, the different types, the symptoms, and the treatment and coping skills of this illness. So many people ask, what is anxiety, or they do not believe it is a real thing. Anxiety is not just being stressed out or nervous. Anxiety is a paralyzing fear in the core of your chest and stomach that spreads into your arms and legs, and the uneasiness causes an overwhelming panic, which then causes an anxiety attack or a panic attack. There are many different types of anxiety, and each affects a person in a different way. There are many different symptoms a person may experience and multiple treatments and coping skills for this illness. Anxiety can be from anticipatory worries, debilitating fears, or an inability to concentrate. And although there are many things that can cause anxiety or make someone's anxiety worse, one thing that anxiety is not caused by something wrong with biochemistry. Many people do not believe anxiety is a real thing until they experience it themselves, and many people will not have to experience it at all in their lifetime. But as I said in the beginning of this video, that anxiety is one of the most common illnesses in the United States. It affects 40 million adults in the U.S. age 18 or older, and affects about 28% of the population at some point. There are four main types of anxiety: psychoanalytic, which happens from trauma, danger, shame, humiliation, or the fear of not being able to make a perfect impression. The second one is the behavioral approach, which is focused on seeking out and achieving pleasurable goals. A person's factors that are affecting these problems and are examined, or a person plays a functioning role in certain actions in order to deal with their problem. The third one is biological, which happens from genetics or the body's fight or flight response. And the fourth one, which is probably the most common, which is the humanistic, is from death. So if you lose a loved one, loneliness, if you feel alone, you have no one to talk to or no one to go to, and isolation. There are many different symptoms for anxiety, and these can be feelings of danger, panic, or dread, increased or heavy sweating, rapid heart rate, breathing or hyperventilation, weakness and lethargy, or trembling and muscle twitching. So although there are many different treatments and medications or different skills that you could do for the different types, there are medications that can help with almost any type of anxiety, and just going to therapy helps with almost any type. But there are four different types that I talked about, and each type has a different medication that I will be explaining. So the first one is for psychoanalytic is cognitive behavioral therapy, psychodynamic therapy, and going to a psychotherapist. The second one is behavioral, which the treatments for that is tricyclic and monoamine oxidase. And then for biological, there is SSRI, which is selective serotonin reuptake inhibitors, and GABA, which is gamma aminobutyric acid. And for the humanistic, it's just getting support. So get yourself a support system, focus on positive traits and behaviors, and focus on meeting the needs for yourself. So one thing I want you to take away from this video is that if you know somebody with anxiety, they are not being dramatic and they are not lying about it, and you need to either either help them in any way you can or get them the proper help they need so they can get better from this illness and not have to suffer. So thank you.